Thank you very much. Let's take our seats. Good afternoon, everybody. Kenya and the United Kingdom share a long-standing strategic partnership anchored on 5 key pillars: mutual prosperity, security, sustainable development, climate action, and people-to-people connections. Today, our collaboration is alleviating health budget cuts across the pillars and symbolizes this partnership at its best. The Kenya-UK Health Alliance is a flagship model of what our countries can achieve when we bring together expertise, resources, and shared values. Through the alliance, our two nations are delivering meaningful collaboration in research, clinical excellence, workforce development, and innovation, and helping to strengthen our health systems and improve lives on both sides. The alliance has already brought together renowned institutions in both countries. For example, the partnership between Kenyatta University Teaching and Referral Research Hospital, the University of Manchester, and Christie NHS Foundation Trust has supported the deployment of Kenya's first mobile endoscopy unit to screen for esophageal cancer. Other initiatives include building emergency medical training in Kisii and programs supporting breast cancer patients with life-saving counseling models. I'm also proud of the collaboration between King's College London and health professionals in Kenya to establish a diabetes food center for excellence at the Coast General Hospital in Mombasa. This partnership has facilitated remote consultations, training via digital platforms, and knowledge exchange to address the specific challenges of diabetic food care. Such projects illustrate the Kenya-UK Alliance role in advancing local capacity and delivering care that is tailored to our people's needs. Importantly, these collaborations are sustainable as they are based on building Kenyan expertise. For example, thanks to the partnership led by the Alda Hey Children's Hospital, more than 340 pediatric heart surgeries have been performed in Kenya, with the latest 43 being carried out entirely by Kenyan professionals. Beyond clinical collaboration, our research partnerships are equally significant. The Kemri Wellcome Trust research program demonstrates how shared research can strengthen national health responses. During the COVID-19 pandemic, this partnership delivered vital diagnostic support and evidence to guide our response. Additionally, the US $25 million Sambai Cancer Grand Challenge Consortium is advancing our understanding of cancer genomics in Kenya, building local capacity, and informing better care. Such partnerships are also looking far into the future. The BRITE Kenya project, in collaboration with the Liverpool School of Tropical Medicine, will help establish local manufacturing capacity for vaccines, monoclonal antibodies, and antivenoms. This will not only reduce dependence on exports, but also strengthen Kenya's role as a regional health hub, creating jobs and ensuring sustainable access to critical medicine. We are also proud of our partnership with universities such as Nottingham, Oxford, and King's College London. These collaborations support training, mentorship, and the development of critical skills to strengthen our medical education and workforce. This is essential to Kenya as we work to expand access to quality care across the country. Ladies and gentlemen, Kenya is fully committed to achieving universal health coverage, a cornerstone of our Vision 2030, and our health sector strategic plan. Through the bottom-up economic transformation agenda, we are investing in a fully and publicly financed primary health care system, the emergency care fund, and social health insurance fund that will cover all Kenyans. I remember very well when Graham visited me in Nairobi, and I informed him then that if there was one thing that I wanted to do as president was to finally work on universal health coverage. And you have mentioned something very fundamental here. You have said it must be sustainable, it must be of high quality, and it must be, you said one final thing. You said sustainable, you said high quality, and you said it must be universal. Those are the three things I heard you say. And I want to confirm that that is the template upon which we are working on universal health coverage in Kenya. And Dr. Oluga here has clarity from me on what needs to be done. You've just heard the instructions from Graham there: sustainable, high quality, and universal. All right? And it is one thing that I purposed that we must achieve. And I want to give you some good news ever since you left, apart from what we have done with community health workers, which we changed the nomenclature to community health promoters. We now have 107,000 community health promoters in Kenya. Their stipend is shared between the national government and the county governments. Governor Sakaja here, the governor of the city of Nairobi, will tell you he has 7,840 community health promoters in Nairobi. Just one county. And it is the infrastructure that supports health at the very bottom of the pyramid. Every community health promoter has a couple of homesteads to think about. And apart from building that solid base and making sure that these promoters are people who have been trained on the very basics of what to look out in communities, especially when we are trying to attend to them on matters health. But we have also built a bigger ecosystem now. We have transitioned what we had as matters health. But we have also built a bigger ecosystem now. We have transitioned what we had as just 2% for health insurance of their incomes, while the much more endowed members of our society were paying less than 0.1% for health insurance. We decided to make an equitable program, to create equity and to create uniformity. So everybody today in Kenya pays 2.75% of their income. For the vulnerable members of our society, health insurance has come down from 10% to 2.75%. For the rest of us, it's gone up from 0.1% to 2.75% of our incomes. And by so doing, we have created sustainable funding. You know, we can now predict with much more accuracy and clarity how we are going to take care of our health infrastructure. In fact, just to give you numbers, by the end of this year, when we are doing the first anniversary, health insurance will pay for 3 times more people than it has done in the past. And we have managed to bring into the health insurance space 3 times more people, in fact more, because we had about 7 million people in health, on health insurance a year ago. We now have 24 million people. In the last 1 year, we have brought on board another almost 14 million people. And just so that you know how transformative it is, every day, 50,000 on average, between 40 and 60,000 Kenyans register themselves on our health platform. And slowly, progressively, many Kenyans are now realizing the importance of being in that platform. And we are confident that we will be able to reduce out-of-pocket expenditure, fundraisings, and many other things that occasionally become part of health delivery because there wasn't a predictable way of making it sustainable. You find families selling their assets, selling their land, selling their livestock, selling their wares because they want to go and pay for somebody in hospital. We want to make that a thing of the past. On making it high quality, my friend Sakaja here will tell you that we are now working with them on how to have equipment in our hospitals and have those equipments in a way that doesn't strain our budgets. That we've now worked with manufacturers for them to deliver equipment, and we pay on a program of pay for service or fee for service, so that we don't have to buy an MRI, for example, or a CT scan for a hospital. A CT scan is available at the hospital, and we pay for as many times as we use it. If for one reason or another it breaks down, it is the responsibility of the manufacturer to repair it. We will wait. We will pay nothing until they repair it, and then we continue using it. So to create that space, and also to make sure that there are health commodities in our hospitals, specifically to make sure that health is of such quality that it deserves, or our citizens deserve. I'm very happy that President Orama and Afreximbank are working on how we can now enhance that quality, make sure that we have centers of excellence on matters health. And please, Professor Orama, let us have a conversation. You are my friend, at the very least, so that we can have one in Kenya. And thirdly is to make it universal. I mean, there is no other way of making health universal rather than the public sector stepping in for the people who cannot afford. And that is the structure we have built, that while those who can afford can pay 2.75% for indigents, and those who cannot afford to pay, the government of Kenya will step in, because we must make it universal. It must be available for everybody. So I am very happy that we are making this progress together. And this consortium of universities here in the UK, working with us in this Kenya-UK Health Alliance, is a step in the right direction and has the support, the endorsement of my administration. And you can count on my support and count on my leadership as we work on this together. On behalf of the government and people of Kenya, I express my very sincere appreciation to all the members of the Kenya-UK Health Alliance, to His Majesty's government, and to all our partners for your steadfast support. This collaboration is central to our national development goals and to the health and well-being of our citizens. I reaffirm Kenya's commitment to deepening our partnership with the UK in health and looking forward to welcoming you all to Kenya as we continue this shared journey of collaboration and progress. And I thank you very much.
Thank you, Your Excellency. So now we will welcome the University of Nottingham and King's College London, the Vice-Chancellors, and Your Excellency, together with the Vice-Chancellor, if you could just, with your indulgence, sir, just stand behind them so that as they sign. Okay, please. The High Commissioner, Kenya's High Commissioner to the UK. Yeah. Thank you, Your Excellency. While you are still standing, we would like again for the gifts to be brought just for recognition of some of the work that has happened. Yeah, let's come back. Yes, Your Excellency.